Hello, welcome. Thank you for joining us for the Center of Justice and Law Spotlight Conversation series, where we talk about the topics on health justice and law with our lovely guests. I am Ubah, and I am a student coordinator for the CJL at Hamline. This is our first spotlight to pressure, and our conversation is around the topic of immigrant and refugee health. And so, our conversation today is with our lovely Ridwaan. And Ridwan, thank you for joining us.
Hello. Do you want me to
Um,
introduce
yeah,
myself?
you can basically introduce yourself.
Um, my name is Ridwaan, and it's also Fatima. And I don't really have a strong preference anymore because people kind of just call me whatever they feel like. And it's just like, okay, it's just a name. It's not that serious. But I mean, it would be nice to hear Ridwaan more often, but I only hear it from my mother now. Like when I was in Africa, everyone called me Ridwaan, but now everyone calls me Fatima, and it's like my mom's the only time I hear Ridwaan, and it's just like, oh yeah, that's still my name. And now at Hamlin, because I logged like the thing where it's like, what would you like to be called? I put it as like Ridwaan, so now everyone has to call me Ridwaan. It's nice.
Yeah. Well, Ridwan is our lovely guest, and would you like to elaborate more, like what year you're in, like things of
Oh yeah. Um, I'm a third year, and I'm majoring in psychology and religion.
yeah.
Because
Nice. Well, I've asked you to join us because your story coming in as a refugee and just your stance on like refugee related issues very inspiring to me. And I love to hear it. And I'm sure a lot of people would love to hear it. And it's always interesting to kind of just see how the transition, especially as a refugee or even an immigrant child, towards like a cultural shock in America, if you weren't from here, or like even the cultural shock from like a parent perspective and things like that. And oftentimes people do make it through and it does become a success story. And so, can you tell us more about like the things that you've seen done in communities that sort of help refugees and like immigrant families and things like that?
um for my like when I specifically came to the US, it was me and my mom and like her my siblings, and it was just us, and then we had like a Somali, and I don't remember what the organization was called, but I don't think it's a Minnesota based one, or I don't even know if they have it in Minnesota, but it was in Utah, and they have this they have a name obviously, but they had this Somali guy that like we spoke no English. We were like coming out of like at first it was like a whole process. We had to leave Somalia and we had to go to Addis Ababa, and then so that itself was like a whole move, you know. And then so we had to be there for a couple of years before they like sent us off to some Western country. So we had to like me and my sister had to go to school, and we had to learn Amharic, and then we had to adjust, and then it was just like the first time it was just like, oh, okay, new country, new language, gotta learn it. And then the second time it was just like, okay, here we go again. But the second time, which was when we came to the US all the way like freaking across the ocean, it was it wasn't I don't know, I didn't feel a difference. We had a Somali guy that met us there, and they had like our house set up and everything with like chairs, living room, everything set up, and we just had to go in and live there. And then my I think my mother probably had the hardest transition because she was like fully grown, like an adult. And then we were just like, I was 10 and I was the oldest, so it was like nothing for me, but my mom probably had to like it was probably the hardest for her because she had to like learn how to drive, learn this new language, and then she had to go to work. It was a lot, but she did it and I think that's the thing that I think needs more of a spotlight. There are a lot of immigrant parents, and there's this immigrant parent trauma thing where they don't even have time to process it or time to be like, oh, I'm traumatized. Because they're just like, oh, new country, go, go, go. And like they have all these kids that they have to provide for, and they just have to adjust themselves like, and there's no time to stop and think and be like, am I okay? And so I think a lot of immigrant parents need to go to therapy. That's kind of why I'm studying psych, because I want to be a therapist and I want to be like, hi, welcome, and let's talk about your trauma. And like, I think we need a lot more immigrant therapists, because like when I go to therapy, well, I don't go to, it's not a regular thing. I went to therapy one time, but I think everyone should go to therapy and it should be a regular thing, because everyone's low-key just like needs help. And I spent like a fat minute just explaining who I was, like what it meant to be like an immigrant, a Somali, a Muslim. And we just spent the whole session talking about like my identities when I didn't want to talk about my identities, because sometimes you just want to get like right into it and be like, here's the issue I want to focus on, but oftentimes you have to stop every time and then explain what that thing is, and explain how that's not really crazy in your culture, because the way your culture works is different. You know what I mean? And it's just like a whole thing. But anyways.
No, I do understand. I think of like things of the spectrum of like the stigmatized within like the cultural region perspective of things, especially like refugees coming into like a new country that you don't know, people that you don't associate any similarities with, and like just kind of have to pick up learning the language, but also realizing like you will face a lot of issues of like language barrier, a lot of cultural shock, a lot of like new things that you're being introduced to, and like kind of having that setback of like, will people understand my culture and like things like that? Well, will they help make the transition even a good experience for me? Had it been like the refugee like experience could have been bad, but what's like the end goal of it? Am I gonna have a successful story and things like that? And so I think it's always nice to see that kind of pan out in the end things. And I think as a person who has been through that obstacle as well too, like I see myself as a success story, but I also think of the other person who maybe hasn't had the chance to like have a success story. And so like what are some experience, it could be a good experience, it could be a bad experience, and like what are things that you wish could be changed within like transitional like time periods of like a new immigrant, like a new refugees coming in, and especially like when you think of things like healthcare and like things that sort of cater to like our personal growth, because health is basically everything, whether that is like from the environment that we're living in or like the school systems that we go into and like things like that. So
I don't know. My biggest obstacle has just been like the whole. Well, it's not my biggest obstacle. I see other people, and it's a big obstacle for them, because I was 10, and I already had to do the immigrant thing in Ethiopia, like in Addis Ababa, and just like jump on Amharic and fucking figure it out real quick. And then it was just like doing it again, and it was just like nothing. But I see other people, especially like parents, when they like they get denied like job opportunities because of an accent, and they get like belittled because of an accent. Like, you will see overly qualified people being made fun of, people who do like hard work and they, you know, give back to the community, and they're not taken seriously and they get made fun of because they have an accent. Mind you, the people that are making fun of them speak like one language. These people speak like 3 to 5 languages, and you will have someone else be like, ha ha ha, you have an accent, while like all they speak is English. And it's just like, wow. Just like, I don't want to be negative, but I think, I just think it's very dumb. It's like you speak one language and you have the audacity to be like, oh my god, go learn English. Or like, it's just so dumb. Like, you speak one language. I'm over here speaking 3 different languages to you, and you want to focus on the fact that I have an accent? Okay. But anyways, yeah. I think it's ridiculous.
I do see your point and how that can have like a negative transition.
Especially in healthcare, I'm sorry, especially in healthcare, they'll be like, can you get me, like, the freaking patients, man, they're rude too. They'll be like, can you get me someone that, like, speaks English? And it's just like, okay. And then, like, I worked at this nursing home, and so did my husband. And he was telling me how this one Somali mother, um, she was like, you know, doing her job. And this person has the audacity to be like, I don't understand you. Get me someone that speaks English. And then there was the fucking receptionist lady, and she was so rude to her. This is like the beginning. I'm sorry, I'm getting too passionate. It's not that deep. It is so deep, but this is not the place. Basically, this lady comes into work, right? She's a Hoyle, right? And she's like, oh, I forgot my mask at home today. Can I get a shield? The receptionist lady has loads of shields behind her. It's her job to give people who forgot their shields a shield. And she's just being like so fucking rude to this Hoyle. And then, like, it's just like, for what? It's your job to give her a shield. She's asking for a shield, and you're being such a dick because why? Because she has an accent. And it was very rude. And then, like, she never does that to anyone else. And if I was there, I would have started some. Well, I would not have started some shit, because no, okay, I would have just addressed the situation. And a lot of people see that as starting some shit. It's not starting some shit. There's a situation. It's not correct. It needs to be addressed. I'm gonna talk to you about it. That's it. But anyways, my husband was all like, he was the one that was telling me this. Alhamdulillah, that wasn't me in that situation, because he's a nice person. I'm a sweet person too. I'm really nice. It's just that I can get very, like, confrontational. Like, to me, when I'm talking to you and you're doing something dumb, it's not going to be like, I'm not going to be from the perspective of, like, when you're doing something dumb like that and you're just being discriminatory, I'm not going to be like, hey, I'm not going to be like chill with you. I'm just going to be like, why are you doing that? That's not right. And people don't like that because it's confrontational. But anyways, he was just like, oh, can you give her a mask? And anyways, it was a whole thing, and it was very rude. And I think that's one of the biggest, like, annoyance of being an immigrant with an accent. Everyone just belittles you, and then they belittle your.
And how that can sort of deteriorate, like have an impact on like the kind of transition one has, especially with like healthcare and like as an immigrant asking for questions and then getting turned down and like things like that. And so like what are ways that maybe you could think of, like it could be like policies that could be set to sort of help immigrants and refugees have a good transition? It could be just as simple of like a guidance coming into the USA and like how the healthcare system can sort of like navigate with them and kind of help that transition become a good rather than a negative connotation to it. Because mind you, there's a lot of people who come in, especially parents who don't maybe speak English, and then the kids are always like there to kind of help out. Maybe that could have lessened the burden for the kid, and so the kid can be a kid instead of a kid with a responsibility that maybe they shouldn't have carried on. And so what are maybe future changes that you wish you could see implemented in like within the refugee health system kind of things?
I think we just should have, like, more interpreters, to be honest. Like, there was no reason for me to be interpreting my mother's documents. Like, I don't even know what that freaking says. I'm not a doctor. I don't know what these words mean. They should have, like, and like, I guess that can be, like, tough as well, because sometimes you just don't have interpreters, like the Rashi. I don't know. But basically, I feel like it's tough, because on the one hand, you don't have access to those interpreters, but those interpreters are necessary. So that's just, I don't know. It's tough.
Yeah, it is a very hard thing. Like I think of hospitals that people go to that already have those interpreters like available to them, but I also think of like the connotation between it where it's like, oh, she or he like speaks a different language, and maybe the stereotypical thing is like always have an interpreter instead of like asking. And so I think a lot of times people forget to like do that one just a service where it's just like ask the person if they need an interpreter without assuming. But also, even if you do have them, it kind of like brings barriers in between it, because then that kind of throws off the confidential that the not the parent, the patient could have with their doctor, because there's always that in between third person, and it's kind of it it's very much discouraging, almost, I would say, because I don't think, like, as an immigrant, a lot of times our parents are very much scared of like the American like system, maybe when you think of like healthcare and how it's not very much like culturally appropriate to us. And so, like, when I think of things your mother could actually say to, like, when you think of the hypothetical situation, to like a specifically doctor who shares the same cultural values as her, rather than to like someone who doesn't share that, and always think of like that third person in between and how that affects the transition within that doctor's appointment and things like that. And so, validly enough, I do agree that we don't have enough interpreters, at least. And
Yeah.
so, like, what is like your perspective, or like even like a message that you would leave on for like this topic itself, and like based on like your experiences that you've had, whether that is a good experience that you've had coming in, whether that is like a bad experience, like what is some words of wisdom or like a message that you would leave out, because everyone has like a different story, a different like success stories and like things like that, and that could just be like how you've transitioned within like your grade schools or like high school, and how that has affected like your choices that you're making now as like college students and things like that.
Um, I don't know what you mean by success story. You keep saying that. Can you, like,
Yeah.
how do you define success? Is
I
it
think
get rich and now you're making money and you're not like
no.
poor anymore? Or like, what do
No.
you mean?
I think when I think of success story, like I think of like myself, I think of like moving into the USA with the knowledge of knowing English, but knowing that I moved in with like my mother who didn't know English, and then taking like that burden of like doing the translating work for her, but also still navigating to like still be a kid, staying on top of like the things that I am supposed to be doing, and not letting the things that I've been through kind of discourage me from reaching my success level, at least. And so, like, focusing on my education and not worrying a lot about like the cultural shock I'm experiencing as well, and like making the best out of it, because granted, like we all know, the community that maybe we do come from doesn't believe in things like mental health, but also still like pushing through, you know?
Mm,
Yeah.
I see.
Yeah.
I think. So, like, basically,
Like, basically, what are like some words of wisdom, or like just a message that you would leave on like the topic of refugee and immigrants? Because a lot of people like think refugee and immigrants, there's always like a bad connotation tied to it. And
there's,
most times there is, but a lot of times there's good things and bad. So
did you say most times there is?
I think for some there's, I when I think of like my story, I think of like a lot of people can dwell on
I
bad.
thought you were
No,
trying to tell me that
no, no,
it's like, okay, I was about to say, wait.
no.
But you mean like the experience of like coming to a new, completely different country with a
Mhm.
different language and all these weird customs? Yeah, that can be a bit shocking. Like, like before I came here, I had never seen a lot of people. I thought the world was just like, oh, like you got China and then you got Arabia and then there's Africa, and that was it. That was the whole world. There was China, Arabia, and like that's not even placed. Like I was thinking like, and like I was thinking Arabs are just like one type of people. Like they're all, and like India, like it was China, India, wherever Arabs come from. It's probably called Arabaha or something, and then it's Africa, and that's it. And wherever like the blue-eyed people come from. It was very funny when I came here, and everyone's just like different, and I was just like, "Oh, you mean there's more to the spectrum of colors?" It was a very interesting experience. Um, I just think like for the most important thing is I don't know, you just at some point get therapy because you gotta like you're just there's this thing when you're an immigrant, it's just you just go, 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 and you never really sit down with your emotions and you never. I didn't even know there were more feelings than anger, sadness, and happiness. It was just like you're either angry or you're happy, and then you are rarely sad. And there's more than those feelings apparently, and it's kind of hard to navigate that because I never really like thought about them. So now I have to like learn emotions and how to express myself. It's very weird because I was never for like, and that's just the thing. That's not even like specific to immigrants. That's just the thing. Some people just don't express themselves vocally. But I think we should all go to therapy, is my point, because we all need to like understand ourselves. And a lot of us do not understand ourselves because you never get the chance to. And nobody wants to do yoga. I mean, meditation, not yoga. Nobody wants to meditate because it's just like, oh, I don't want to sit down cross legged for like that. Like, that would hurt my legs. It's not that. You don't have to do that one specifically. There's like many forms of meditation. Like, people need to meditate, people need to go to therapy. Like, the thing with therapy is you already do that. Like, you already be like telling your feelings and everything to a friend. But that friend, like, the difference between like your friend and an actual therapist is this person is, you know, qualified and they know a lot. Your friend also knows a lot, just not specifically in handling people dumping their emotions on them. Or maybe they do, I don't know. But the point is, everybody needs to go to therapy and talk about their feelings so we can have a better world. Because did you know that a lot of people go to therapy because people who like need to go to therapy don't go to therapy, and then they just like hurt other people, and then these people have. But anyways, therapy.
I think
That's
there's like always barrier when it comes to like mental health within like a specific region itself too. Like I don't know. I don't
I
always
think
think
it's
it's
because
like
like
the easiest thing for one to like pick up and per se just be like go because like for example, for instance, I'm gonna use myself as an example. Like I'm an immigrant child. I know I came into the USA as a refugee, but then I also think of the connotation tied to it where I'm like, if I ever sat down with my mom and be like, mother, I need to go to therapy, it'd always be like the opposite end of things where it's like maybe you need to pray more and like no one really thinks of mental health as
praying more is not a bad idea.
it's not
Okay,
a bad idea, but I
but
think more
sometimes you
thing.
need a little assistance. A little bit more. Like sometimes it doesn't like that you gotta take. You can't just be like, oh, I'm just gonna pray. I don't really need my medication.
Mhm.
Sometimes you gotta do both. Just pray and take your medication. But anyways, um, I think that the stigma with mental health, I think it's because like usually when someone tells you to go to therapy, why are they telling you? Like when you are allowed to go to therapy and it has I can't go to therapy. I'm not really depressed. And like there's also that thing where like all over social media there's these cute quotes that's like live, love, laugh, and like just gotta cry, Sometimes you have to be sad. There's just such a like thing with society of like just putting aside these negative emotions. The negative emotions are necessary. You know what I mean? And because people don't like it, because it's not fun, but it's necessary. And so there's always just this thing that's just like, oh, forget about that. Just like forget about that. Just be happy. Like happiness has just been pushed so much that it's actually causing issues now, which is ironic.
Yeah, I do agree, but I think in all aspects we all have to be worried about our health in general, whether that is physical and mental, and like kind of figure that out in order to even make growth or anything like that. But to cut you short, thank you for everyone who has joined in and watched our little session. I really do hope you enjoyed it and laughed a little bit if you could. And thank you, Ridwaan, for coming in and just talking to me and just conversing and even sharing your experience. I know it takes a lot for a lot of people to even share anything. So I am very thankful for you sharing your story coming into the USA, even as an immigrant, like the things that you have faced, the good or and the bad. Those are all important and are part of the story. And so I thank you for that.
You're welcome.
Thank you for everyone who has joined in. Be sure to tune in to our social media to keep up to date with other spotlight discussion with our other lovely guests that we might have later on. So thank you.